I had a stroke in 2018 that affected the right side of my body. It affected my life in every way. Everything from putting on my shirt to brushing my teeth was changed. Prior to the stroke, I rode a bicycle, kayaked, was boating, hiking, doing a lot of outside activities. I just can't do those things safely.
Here in the southeastern part of the United States, we call this the stroke belt because more people have strokes in this part of the country than any other part of the country. And stroke is sometimes called brain attack. And what that means is that when somebody has a stroke, their brain is injured to some extent, and it leaves them with problems with things like thinking or seeing or moving or coordinating their hands or their fingers, and sometimes speech.
It's very awkward when your brain's trying to tell your arm to grab the fork, but your hand won't grab the fork. So you have to learn to adjust to the situation and find, in some cases, an alternate way of doing things.
Last week when we tried this, you didn't use the modified handle, so I'm curious to see how you feel this will feel.
I like to call it's brain therapy. It's not arm therapy. You know, we're constantly working on rehabilitation after a stroke, and so connecting what we're thinking with what we're doing and how our body is interacting together.
I met with Jewel, and she told me what the Telerehab was going to be about, and I thought, well, I'll try it.
So as occupational therapists, we're very activity focused, and the best part about this program is that we are in a patient's home via video, so they're in their own environment. Their entire home is their therapy room. They can look around and see objects that they commonly interact with, and they might have difficulty doing laundry, and so we can set up the computer or the tablet to be in their laundry room. We can work on different techniques that allows them to have success in whatever environment they choose. And so it's a really special way to connect with a patient and be able to bring therapy into their lives and meet them where they are.
In South Carolina, the stroke rehabilitation specialists are scattered across the state. And so therefore, stroke survivors in South Carolina may not be able to easily access the specialty stroke rehabilitation care that they need. It might just be too far to drive to a specialty clinic. So what we're trying to do in this stroke telerehabilitation occupational therapy program is provide opportunities for people to access rehabilitation services when they can't access them by going to a clinic.
Take your time.
Okay.
Nice deep breath.
As it turned out, the personal touch has been much greater than I thought. It's also good that you're in your own home. You're not going to a strange place, and it's not, you have to get ready, you travel to Charleston or something, and then you sit in a strange room and talk to someone and do this. You're in your own home, and it's very, very nice.
It's interesting because telerehabilitation or telehealth in general is fairly new to most people. And I would say most people are hesitant. Telerehab is brand new for most people. And so it's always a little bit of a concern because when something is new, there's thoughts about, will it work? I'm not sure that this is exactly what I want to do. Part of this program includes an initial education session or two where we help the person with stroke, and oftentimes the caregiver of the person with stroke. We help them understand what the program is, what to expect, how to use the technology. And what we found so far is the people who have been involved really like it a lot. And it has gone above and beyond expectations, and our patients have been satisfied. and encouraged, and I think pretty excited about the rehab option.
Thanks to MUSC and this program of telehealth has been a real blessing to me. It opens up my eyes to different abilities I have, but I don't know I have.